We've all been hearing about Tiger Woods' most recent motor vehicle accident in the news and his subsequent arrest. And the question that comes to my mind as an addiction expert and scientist is, what will it take for Tiger Woods to truly fight for his recovery from addiction? Hello and welcome to the Dr. Suzette Glasner podcast. Tiger Woods, 50-year-old legendary golfer, was arrested in Florida last week after he hit a vehicle and rolled his Land Rover. After he refused a drug test, he was charged with driving under the influence. This is his second such arrest and his fourth high-profile crash. He had 2 opioid painkillers in his pocket, and though he did blow a 0 on the alcohol breathalyzer test, he did appear reportedly to be under the influence of some type of substance, and his eyes were described as bloodshot and glassy. His story has raised many questions. As an addiction expert, I'm going to give you my take on 2 of them. The first is, why is he still in this cycle of destruction when he, of all people, has all the resources anyone could need to fight addiction? The second is, how could hydrocodone, which is the type of pill that was found in his pocket, cause this accident? And if he legitimately needed to take hydrocodone for his injuries, why doesn't he hire a private driver? That's a question a lot of people have raised recently. On the first one, why is Tiger Woods stuck in this cycle of destruction? We've been hearing about this for years. My short answer is that addiction does not discriminate. This is what we understand from research studies for decades on addiction. It can destroy the lives of wealthy people, poor people, people who have great parents, and people who have no parents. It can destroy the lives of people with successful careers. As we know, Tiger Woods has been incredibly successful, and it can destroy the lives of people who are unemployed. Some people who have families and some people who are all alone. It's because it's a brain disease, and when it takes over, logical reasoning and judgment go out the window because the brain is impaired and unable to make good choices and exercise good judgment. The brain becomes unable to inhibit impulses, and the impulse in somebody who is physiologically and psychologically dependent on a substance is to continually feed the brain with more of that substance, no matter what it costs them. And we are seeing this firsthand with Tiger Woods right now. His story really highlights some of the aspects of addiction that are really the most difficult to witness and comprehend, which is that he stands to lose a lot from the misuse of substances, but he's using them anyway. And that really is the hallmark sign of a severe and serious addiction. So let me give you some examples of what Tiger Woods stands to lose from incidents like what happened last week. He not only has a history of substance addiction, but he also has a history of sex addiction, which reportedly ruined his marriage more than a decade ago after multiple affairs. Despite his engagement in treatment for it, it just may have been too late. It has taken him quite a bit of time to rebuild his life since the end of his marriage, but he is now reportedly in a pretty serious and meaningful relationship with Vanessa Trump, which he publicized last year in 2025. Vanessa Trump is the former wife of Donald Trump Jr. and mother of 5. The accident actually risks straining that relationship, with reports of Secret Service having banned Tiger Woods from driving Vanessa's children around even prior to this incident. So something has been brewing for some time. His career is in a place where he was ready to make a comeback, having returned to professional golf for the first time since 2024 in recent weeks. And an episode like this stands to put a stop to his continuation of that. That's a lot on the line, but that is what we see in severe and serious addiction, that despite the fact that there's so much at stake for people, they have the potential to lose their family, their job, their health, their safety, even their life, they continue to use substances anyway. We know that Tiger Woods has a pretty serious history of addiction. He has had multiple treatment episodes for prescription substance use addiction. He has a lot of risk factors for continued addiction if something doesn't change. And his kind of addiction is a bit scary because it is quite life-threatening. He has a history of what we call polysubstance use, and polysubstance use is where a person either misuses or becomes dependent on a variety of substances And we're seeing increasingly that overdose deaths are attributable to polysubstance use and the mixing of downers with other downers. And we've seen Tiger Woods do this on multiple occasions. So just to give you a rundown of some of his history, in November of 2009, he slammed his Cadillac Escalade into a neighbor's tree outside of his home while he was driving under the influence of sleeping pills. And that was in the wake of this very explosive cheating scandal and sex addiction scandal that ended his marriage. Then in 2017, he was arrested for driving high on prescription pills. Now this time, there were 6 substances found, at least, in his system: Vicodin, Dilaudid, Xanax, Ambien, and THC. The police found him asleep behind the wheel about 15 miles from his home with the engine running, which he later blamed on a bad mix of pain medications. So here, with all those substances that I listed, he was mixing opioids, benzodiazepines, which I've spoken recently about on this podcast as far as the risk of overdose, sedatives, and cannabis. This is a scenario where there's a very high mortality risk, and quite frankly, Tiger Woods is very lucky to be alive. He was also involved in a one-car rollover crash in Los Angeles in 2021, which left him with really serious and catastrophic leg injuries. According to Golf Digest, he suffered fractures to both the upper and lower portions of his tibia and fibula in his right leg. Over the past couple of years, he's also dealt with a ruptured Achilles tendon, and he also underwent lumbar disc replacement surgery in October of 2025. The reason I'm making mention of all of this is that physical health and pain conditions, especially when painkillers are prescribed to someone with a prior addiction history like Tiger Woods, are very strong risk factors for addictive behavior. Some of you may know that he also lost his mother in 2025. She was a real anchor and source of support for him through all of his ups and downs with addiction and divorce and widely publicized news stories surrounding his very personal struggles. And we also know that trauma and loss and bereavement can be pretty major triggers for people with addiction history for a decline and a progression of their substance use disorder. So we may be seeing some of that at play right now. I also want to note that polysubstance use can be especially complicated to treat. It's not impossible, but it's particularly risky from an overdose and mortality perspective. Tiger Woods is in need of some serious help right now in order to save his life. So what needs to change? The biggest thing that I see that needs to change is that he needs to develop the insight that he has lost control over his use of substances and his life to such a degree that the only way for him to make a comeback from this is to prioritize and take treatment very seriously. Now, we do have some indication that he's doing that because he has very recently stated that he's going to take a step back from his career as an athlete, and he is going to seek treatment in response to what's recently happened. So the hope is that he's really serious about this, that that's not just for optics, but that is something that he's really taking seriously. What's concerning is that in the news reports, some individuals who are close to Woods say that he likes to do things his way and can reject conventional ways of solving problems. Treatment is kind of a conventional idea, so if this makes him resistant to treatment and to letting himself be guided by experts in addiction, it could be a pretty major barrier. However, the fact that he's taking this step to initiate treatment is a positive sign. Usually, severe addiction of his nature benefits from treatment with a combination of medication as well as psychotherapy, and the longer a person remains in treatment, the better. He would need to be open to not rejecting the most efficacious types of approaches that include both medication and psychotherapy, and to remain in treatment and keep it as his priority. And that would require sort of this very intrinsic motivation. This is vital for him to save his own life and to preserve all of the beautiful things that he has in his life, including his relationship and potentially his future career. What else does he need in order to recover? People talk about rock bottom a lot, and it's not a black or white thing. But the question is, has Tiger Woods actually hit rock bottom? Because rock bottom looks very different for different people. Not everyone has to have a horrendous bottom in order to develop the insight that they need to change something, but some people do. And I suspect that Tiger Woods may be one of them based on what he's endured in the past and the fact that he hasn't recovered or figured out addiction recovery for himself yet. Some of you may have seen my recent podcast with Aaron Prager, my interview with Aaron Prager, where he spoke about his rock bottom, and it was pretty dark.
My rock bottom, and I could sum it up into one sentence, was when I looked around and I realized I had no one else to blame for my problems. That was my rock bottom, and it was the worst and best place in my entire life.
How did you get to that, though? Like, what made you suddenly realize that you couldn't blame anybody else?
Because I didn't have anybody around me. Everybody left. My mom was dead. My dad told me not to be around his family. I would call my brother when I was drunk to yell about my dad. My stepmother and my stepbrothers didn't want anything to do with me, even though they loved me and they cared about me, but they couldn't do anything to stop me. I had alienated all of my friends. The only people that I hung out with were people who also like to shoot meth. And even them, I had to contend with them, jacking me and beating me up. And, and I'd wake up in a pool of my own blood with my clothes gone or something. It's like, I had to contend with that. So that's my friends. I had nothing in my life. The only reason I was able to afford the apartment that I lived in at the time was because when my mother died, she left me $50,000, which I blew through very rapidly. And I guess that's when I realized I have no one else to blame for my...
Tiger Woods has lost a marriage to addiction. Will he lose another relationship? He may need very clear expectations from Vanessa Trump in order to continue in that relationship. A lot of the time when we come to a point like this where addiction has become life-threatening, the terms and conditions from people around an individual in order to continue to support them, not even financially necessarily, but emotionally, psychologically, have to be super crystal clear. And they have to really feel like they stand to lose something that's really important to them. And sometimes they need to lose a lot of things and a lot of people in their lives in order to develop that insight, as we've seen with individuals like Aaron Prager, who's a great example. So finally, I want to answer this question: does he need a driver? That has been a big question that's been floated in the news. He's got all these resources. Why doesn't he just hire the driver? And I see that as somewhat missing the point. Definitely, I see from a health and safety standpoint, sure, that is a very reasonable and practical solution. If he can't drive safely and if he's having these near-death experiences repeatedly, always behind the wheel or very consistently behind the wheel, then making a vehicle a safe place for him would logically involve hiring a driver. But here's what it misses. It's not going to change his addiction. In fact, it may enable his addiction a little bit because it's another way around using substances and continuing to function and trudge through life like that. He needs to think he's incapable of performing basic responsibilities like driving in order to even submit to the idea that he needs a driver. And that's a key insight that, as of this point, he has seemed to lack. We'll see what happens when he goes to treatment. And then finally, I'd like to talk about hydrocodone for just a moment, because that was found in his pocket. And by the way, people don't normally walk around carrying opioid pain pills in their pocket. The fact that he had those pain pills so close to his person psychologically suggests to me that he may be in that cycle of dependency on opioids or other pills, where there's this fear of going into withdrawal and becoming very uncomfortable and needing to have it right there close by in order to prevent or avoid that. That is a classic symptom of severe opioid addiction. Hydrocodone is an opioid painkiller or analgesic. These are medications that should be prescribed short term. That's something we've learned through the opioid crisis, that when we look at sources of the burgeoning opioid crisis and the overdose death crisis, it's the over-prescription of opioids that is largely behind that. And the prescription of opioids, which are medications that are meant for short-term pain relief over the long term, which actually doesn't help pain over the long term. It causes all kinds of problems with rebound pain, and it doesn't really effectively treat the problem, but it does create severe addiction. Tiger Woods' case is quite complicated because he has multiple injuries that probably have him experiencing chronic pain, very difficult to function through, very difficult given his profession. And we have seen other athletes addicted to opioid pain medications for that very same reason, to sort of push through and perform. However, for people with addiction history, it's really important to look at alternatives to opioids because of the very risks that Tiger Woods is facing. So some of the side effects of opioids like hydrocodone are drowsiness, dizziness, and lightheadedness, and people are generally cautioned about driving while taking these medications. There have been some research studies on driving safety on opioids in general, And people who are on a very stable regimen, who are not new to opioids like Tiger Woods, can in theory drive unimpaired while they're on opioids. However, if they have complicating factors like addiction history, which Tiger Woods obviously does, then they're considered to be at risk of what we call neurocognitive impairment, as well as unsafe driving, and are more likely to be arrested in the context of driving. So it's the combination. It's not the medication itself only, although people are generally cautioned against driving when they're on opioid therapies, but it's the addiction history and his history of polysubstance use, where people get into very serious problems with risky driving and where it turns lethal is when they're mixing substances together. And we have very clear history on Tiger Woods that says that he mixed as many as 6 substances together and then got behind the wheel in the past. So he's someone who should not be driving when he's taking opioids, and particularly when he is mixing them with anything else. But based on his addiction history alone, he's someone who shouldn't be driving while taking opioids. So again, in practical terms, the idea of a driver is not bad. However, if he doesn't get his addiction under control, he's going to find himself in other high-risk situations that could cost him his life. I hope the one thing that you take away from this conversation is this concept of enabling. Aaron Prager and I had a conversation about this on my podcast when we had our interview recently. I've had other guests talk about this concept as well. I don't know who may be enabling Tiger Woods in his life. It could be in his relationship with Vanessa Trump. It could be in his relationship with other people who are important to him professionally and personally. But setting very clear boundaries around what is tolerable in a relationship with somebody who's going through something like this, and not doing things that make it easier for them to continue their use of substances, whether that's being there to help them sort of clean up the aftermath and the mess of it, either practically or emotionally or otherwise. Doing things like helping them maintain a supply of pills when they're afraid of going into withdrawal, rather than helping them seek medical care or insisting that they seek medical care in order to break that cycle of withdrawal. Those are some of the types of things that always come from a loving place, not wanting to see somebody you care about suffer, but they can also fuel and maintain somebody's addiction for longer when that addiction is clearly life-threatening, as it is in the case of Tiger Woods. I hope you learned something valuable today, and I look forward to seeing you next time.